Mark, you remember the first time that we met?
Yes.
It was a fire conference.
FDIC.
FDIC. Do you remember the first thing that I said to you?
Yeah, you said you had reached out to a couple other organizations in the past and you just didn't feel safe talking to them.
How important is it that the Brotherhood knows it's safe to be here?
Well, there's a certain level of trust that comes in doing what we do. There's a lot of fear of confidentiality, especially in law enforcement and firefighting, EMS. They don't want anybody to know, especially their employer, because they have a little bit of higher position jobs and they're out in the public eye. And you know, who as a firefighter wants the world to know that they're struggling with some sort of addiction issue or mental health issue? So I think a lot of the hesitancy of first responders even picking up the phone to call for help when they need it is they're afraid of people finding out. So there needs to be a level of trust there, you know, right from the get-go, right when you pick up that phone to call.
So who's taking the call?
When first responders call us here at Transformation to get into the first responder program, it's going to be another first responder. A lot of the times it's going to be me. I take a lot of the calls on my own. And you know, I pretty much, right from the get-go, say, look, you know, what we talk about is between you and I. And, you know, I'm going to help you through that process. Especially when they come here, if they come into the program, the only person that knows they're here is whoever they tell. And they're protected under law that says we're not going to let anybody know they're here. 'Cause, you know, my ultimate goal when anybody calls me, a first responder especially, is I want them back on the job, healthy and happy.
But you know, you say the law, and I know this is something that in our business, we understand the law, we understand HIPAA, we know all this stuff. But is that really the case everywhere? I mean, is everybody, you know, the law's only as good as the people that follow it. So what makes this place different?
Well, I think the staff here, you know, takes great pride in protecting the individual's privacy.
I've asked this question before, you know, in other interviews. What's the chances of somebody here really going back to the station? Are they really going to make it back?
Like I always tell every first responder that calls me, wherever they're at in their mental health or addiction issue, you have a lot more protections if you self-report. Obviously, if they get a DUI and then they come into treatment after the DUI, I can't help with their discipline action because they already got the DUI. But if you come in before you get the DUI, you know, you're protected under Family Medical Leave Act. You can take your sick time, you know, and go back to work, and you're protected.
How big a problem is this really? What's the percentage?
It's statistically 28 to 32% of all firefighters suffer some form of post-traumatic stress or addiction issue. Law enforcement, they say somewhere around 23%. Corrections officers, somewhere around 38%. It depends on what statistic you look at. I just saw a report online where Israeli did a study on their firefighters, and they're saying somewhere between 80 and 90% of all their firefighters are suffering from some form of post-traumatic stress disorder. So, I mean, I don't really, there's a lot of studies out there, so it's hard to really, I guess, determine which one's right, because you have so many in the private sector, then you have a ton, 30,000 volunteer fire departments, and who's keeping track of them? Yeah. So in reality, if we just take the average, and we even take just the low average, and we've got a message that we have to give to administration, which I think you found has been an obstacle. Absolutely.
Fire chiefs and administrators are the ones that are saying, look, we don't even want you talking to our guys. We need to keep them out in the field as long as we can. You know, treat them like robots. They should be tough enough to do the job. I mean, we've discussed all this. But in reality, then the message probably needs to be something like, look, if you've got 40 guys on a volunteer fire department, you have the potential of 16 of them needing treatment at some point in their career.
Sure. And it does, just because they need treatment doesn't mean they have to go into an inpatient treatment center. Everybody's at a different level of their addiction, their mental health issues. It just might mean that they need to go to a counselor once a week. You know, and you know what we try to do when a first responder calls us is find out where they're at. Do they just need a local therapist that they need to go to once a week and talk, get the ball rolling? Maybe they're at the beginning, maybe they're not, you know, having debilitating issues. And it's just something they need to, you know, catch up front.
I remember the movie, and I've thought about this a lot since I met you. The Miracle on 34th Street, and the whole, that whole movie, it really wasn't about Santa Claus. I think it was about a principal, and it was Macy's and Gimbel's, and what made the one department store such a success was that it was willing to say, it's okay if you don't buy here.
Right.
And I've seen that. I've seen that at transformations, a little bit. I've seen that with first responder treatment, definitely. And I think that's your heart that's been revealed to me. You really believe that not everybody needs to come here, but you really don't want to see people come here, do you?
No, I don't. I don't want to see anybody come here if they don't have to. I want them to be healthy and working. Sometimes that's not the case. Sometimes people just are at the bottom and they need, if you need treatment, we're going to tell you you need it. A lot of the struggles, too, with the first responders is convincing them, look, you need to come here.
Right.
They want to be their own doctor or what have you. But we're going to meet you where you're at. We're not going to bring you here if we're not going to be able to help you. If you need a higher level of care, we're going to refer you to a program that's more suitable for what you need. And if you need to go to a local therapist, we're going to get you to a local therapist.
So we've got responders in the building behind us. This is the building where they stay. 5 years ago, if we could go back in time, 5 years, what should have happened?
With myself?
With them. What should have happened 5 years ago?
They probably should have got early intervention.
And could that have happened at the department?
Sure, absolutely. That's one of my biggest arguments with the fire service. I think they're kind of starting to hop on the trend, but I can remember from 1996 to, I think my last fire school was in 2008. Basic structural vehicle rescue, fire ground operations, crew leader, industrial fire brigade, incipient fire brigade, get out alive. I mean, they have a whole 8-hour training on how to get out of a building alive, but I never got one training on mental health.
If they had done that training in the fire hall, when you were in the fire hall, would things have ended up different?
Who knows? I don't think, you really can say, oh, if you gave me that training 8 years ago, I wouldn't have had the problems that I had. Maybe it would have helped, but in my opinion, I think that everybody should at least have the information available to them of what's going to happen. That way they can make their own determination, and you did your part.
You have been at this 2 years
Yes.
with first responder treatment, and this was your vision?
What happened to me was, when I went to go get help for my issues, I got sold on a first responder program, and I guess you could just say it wasn't what it was supposed to be. So when I started at Transformations, I kind of just started calling fire departments. What are you doing with your guys? Do you have a place to go if one of them needs help? And it kind of just snowballed effect from there, and now we're at a full program here.
Do you ever wake up sometimes and either look in the mirror or walk by this building, knowing who's in it, and just stop for a second and think about where you were, what you became, then how you changed, and what you've created? How does that all make you feel when you think about that stuff?
I don't know that I really have time to think about it. It makes me proud that I'm able to, at least see some of them. I wish I could help them all. It's just not possible. But at least, if you helped one, you kind of did your job.
Do you remember the first time that you carried a victim out of a building?
Yes.
Early in your career?
Yes.
Does it feel the same now every time somebody comes here?
No, because they're not victims. They're just people with an addiction issue or a mental health issue. It's definitely treatable, and they're not going to be a victim. They're going to leave here, probably be 100 times better on the job, and then they're going to be able to carry the message that they learned here back to their departments and help others.
This might be hard for you to describe, but how much has your life changed in the last couple of years?
A lot. I don't know that I really can describe it.